Hi everyone, welcome to ResearchMD.com. We got another great presentation today. Again, my name is Pramil Cheriyath. I'm a physician, I'm a program director in internal medicine residency and transitional residency. I teach medical students and residents on a daily basis. So today our topic is about the RBC indices. Make sure you review our previous lecture. We're going to be doing a series of lectures on the hematology topics. So it's important to understand, start from the basic. Let's take some baby steps to understand. So yesterday we did a presentation on like the lineage, the hematopoietic, the stem cells, and how does the cells arrive and all that. Okay. Today we're going to teach you all about what am I going to teach today? RBC indices. Okay. That's what our purpose. So let's start with what is the red blood cell RBC? Somebody give me a definition. What is RBC? It's a hemoglobin containing blood cell that carry oxygen to the tissue in the body, right? Can somebody repeat that one more time?
It's hemoglobin containing blood cells that carry oxygen to the tissues in the body.
Okay, very good. So let's look at some numbers. It's good to know. The hemoglobin, you can see the males is around 4.7 to 6.1 and the female is around 4.2 to 5.4. Okay, and then next thing we have to look at is the hemoglobin. When you look at the hemoglobin, I think it's to understand the structure and how does it work, because that can come into many diseases. You have to put it together. A clinical picture is important. Okay, so hemoglobin structure, you have 2 alpha and 2 beta. Remember that. Okay, then you got heme and Fe2 plus also, the other 2 parts in there. Okay, and some of the diseases you will see some variations on it. We'll come back and talk about that. In order to do that, you have to do the hemoglobin electrophoresis. Mainly, you're looking at the mobility of the hemoglobin in the electromagnetic field when you do that. Okay, so you can see the distribution very clearly, which will come back in about hemoglobin electrophoresis. Let's look at some numbers. What is the number of hemoglobin in normal and male?
14 to 18.
14, 18. And then in the female is around 12 to 16, right? And then we talk about what hematocrit. Somebody tell me the definition of the hematocrit.
It's the percentage of the given volume of the whole blood that is occupied in the packed RBCs.
Okay, yeah, very good. It's a percentage of given volume of the whole blood that is occupied by the packed RBCs. Remember that, okay? So in order to do that, we have to centrifuge the blood, okay? So you take the sample of blood and you put centrifuge. Maybe you have to do like, I think, 3 to 5 minutes and everything kind of settled down. You can mainly see 2 parts. One is like erythrocytes below and the other one is the plasma. Okay, so what you have to do is, you can use the formula. The X is the volume of the erythrocytes in the test tube. Right? You take the X and then you take the whole amount and divide the X by the whole amount in the test tube. Okay? So you get X divided by Y into 100%. So let's say this is 20 and this is 40. Altogether we have like 40 in here and this part is 120. So you take a 0.2, so it's probably like 50%. Right? Everybody got that? So just kind of play with some numbers a little bit. So let's look at when you look at the numbers, it's actually 3 times the hemoglobin if you want to calculate it. Also, you can get an accurate picture. So what happens when you're high? Give me some conditions where you're high hematocrit.
Dehydration.
Yeah, most common when a patient comes to the emergency room, they are dehydrated because they lost a lot of volume. That could be like, what are the other conditions? Anytime somebody with COPD that also can the smoking, right? Hypoxia, erythropoietin stimulation and all that come in bone marrow diseases, which everybody know that. Some condition where there's low hemoglobin, mainly like GI bleeding, acute loss of blood, right? You'll see that. Again, it could be malignancy, leukemia, kidney failure, and so disease can cause anemia, which is very common, and thyroid abnormalities, and then malignancy also we just have to worry about it. Okay, so the most common, if you look at it, I think I would say acute blood loss would be some of the picture right here. So everybody understand that? Let's move into our picture. Like what happened when you take some blood, you centrifuge it. Let's go to the parts. Okay, so when you centrifuge blood, you put in some blood in a test tube, you centrifuge it. This is what you get. So everybody need to know that. What do we have? We got plasma on the top. That's around like almost 55%. Okay, then you have something very low in the middle, which is platelets and WBC. Okay, so we talk about the plasma, and plasma on the top around like 55%, which contain the water, proteins, and lipids. So everybody know that? And next, below that, you have platelets and WBC, platelets and WBC. And everybody know the component of WBC, right? You can put the main 5 components: eosinophils, basophils, neutrophils, monocytes, and lymphocytes. Okay, we're not going into too much detail, but everybody need to know that. So in the middle, what we have is platelets and the WBC. Now, below that, that's where RBC sits, almost like 45%. Everybody got that? That's like you need to understand that, okay? Now let's look at what is the next one we need to know. What is the mean corpuscular volume? It's like MCV, right? That's like a very, very important definition you need to know. It's the mean volume of RBC in a sample. Okay, somebody repeat that. All of you has to repeat. What is MCV?
It's a mean volume of RBC in a sample.
Okay, what is it? Repeat it.
Mean volume of the RBC in the sample.
Okay, so once we know that, okay, we know like, 80 to, first we need to know what is a normal. I would say 80 to 100, okay? When you have low, if it is like a less than 80, then we have to think about microcytic. What's the most common cause of microcytic?
Anemia.
Iron deficiency anemia. But again, you got thalassemia. For thalassemia, what do we have to do? Hemoglobin electrophoresis. Remember. Okay, sideroblastic and anemia, chronic disease. And then between 80 to 100, that's when the normocytic anemia comes in. Then you have to do is like a reticulocyte count. If the reticulocyte count is high, then you have to think about sickle cell anemia, G6PD, hereditary sclerosis, paroxysmal nocturnal hemoglobinuria, and the reticulocyte count is low. What does that mean? Bone marrow is not working. Okay, so it's important to find out how do you there is something called character reticulocyte count, right? You take the reticulocyte percentage into hemoglobin divided by 15. What is 15? Somebody tell me, what is 15?
I think it's mean hemoglobin with 15.
Yeah, that's the population mean of the hemoglobin we use. That like the normal hemoglobin is around 15. Remember that, okay? So we will come back to all of that right here. Okay, now let's look at what happens on this side. You have macrocytic, that's greater than 100, okay? So the first thing I have to do when it's macrocytic, we need to know is megaloblastic or non-megaloblastic. How to differentiate that? Somebody tell me, Laura.
We look at the neutrophils.
You look at the lobes, right? So you look at the lobes of the neutrophil, the nucleus, and they got more than 5. You can pretty much say they're megaloblastic. Okay, what conditions you can have megaloblastic? Somebody tell me that.
B12 deficiency.
Vitamin B12 deficiency is like very common. What else? Folate, Fanconi. Okay, and then like when you look at the lobes of the nucleus, if it is around 3 to 4, that's kind of normal. What do we call that?
Non-megaloblastic.
Non-megaloblastic. Remember, megaloblastic and non-megaloblastic, okay? And then you have like non-megaloblastic, somebody see what's the most common cause, somebody read that? Alcoholic liver disease, right? Alcohol, and then you got diamond black fine anemia, which is maybe like one of the rare causes also, okay? So everybody got that? So always remember the MCV, how the classification, very, very important. Also understand what happens, you have to do if the MCV is normal, then you have the next step of counting the reticulocyte count, and percentage of the reticulocyte count is very, very important, my friends. Okay, now let's come some more definitions. Okay, the next one is called the MCH, mean corpuscular hemoglobin. Somebody tell me, what is that?
The mean mass of the hemoglobin in RBC.
Okay, yes, I'm going to repeat it again. It's the mean mass of hemoglobin in the RBC. Remember that, okay? Mean mass of hemoglobin in the RBC. What is the normal? We got 27 to 31, okay? So, how do you calculate it? Hemoglobin divided by RBC count, okay? The formula is hemoglobin divided by RBC count. So, if it is low, pretty much you can say iron deficiency anemia. Everybody know that, hypochromic, right? And then you can normochromic or hypochromic. And then you have mean corpuscular hemoglobin concentration. When you look at that, that's the mean concentration of hemoglobin in the RBC. Okay, remember that. And what is the formula we use? MCHC is equal to hemoglobin divided by hematocrit. Very simple, right? So you got normal around 32 to 36. And what conditions you can say like high MCHC? Somebody tell me which condition?
Hereditary spherocytosis.
Hereditary spherocytosis. That's a very typical examination question, my friend. So make sure you know MCHC is pretty much, you may want to always kind of think hereditary spherocytosis. Could be in severe burns, or you can maybe they can write a question about autoimmune hemolytic anemia also. Okay. So we covered all of that. Last one we have We got a couple of more actually. Red cell distribution for RDW. That's also very important. We don't look at all of this thing together, putting together, it give you like a complete picture of like what's going on. So what is the definition of RDW? It's a measure of variation in the size of the RBC. Everybody know that. RDW. What's the normal number? Somebody tell me. What is the normal?
11.5.
11 to 14, 11 to 14 or 11 to 15, let's say that. How do you calculate it? You get the standard deviation of MCV divided by mean MCV into 100. Okay, that's how you calculate it. Sometimes, I mean, it's not very important for us to remember all this formula, but you need to know what is the normal, which one is abnormal and all that. Did everybody knows what's going on?
Yes.
Okay. And so when the other thing we need to know about the ESR, right? What is ESR? Is how quickly the RBC settle at the bottom of the blood sample. Okay, if you, that's test you can find out about the ESR. Okay, what is the normal? I mean, there's two values here. The male is different and female is different. Okay, male is like less than 15 and the female is like around less than 20. Okay, so now all of these values is very important. Thank you so much for watching. We'll be back with another presentation tomorrow. Thank you again. Please subscribe to our channel.